Hello, everyone. Thank you for being here and welcome to the last in our Trans Youth Now series, specifically Gender is Developmental, an Approach to Gender Affirming Care, a talk by Dr. Michelle Forcier. I'm Sarah Gamble. I use she and her pronouns, and I run the Pembroke Public Health Collaborative here at the Pembroke Center for Teaching and Research on Women. The goal of this collaborative is to bring together the fields of gender and sexuality studies and public health. And this fall, we have had a focus on trans youth. Trans Youth Now is a series of online events featuring prominent scholars in trans studies and trans health, speaking about existence and resistance in the anti-trans zeitgeist, all of which are available to watch on our YouTube playlist. I am so excited to welcome Michelle Forcier for the fourth and final talk in this series. Dr. Forcier is going to introduce herself, but I want to have a quick housekeeping note that we encourage you to submit questions throughout the talk for Dr. Forcier using the Q&A function. We will have space at the end to address those questions, as many as we can in the time allotted. Thank you so much, and over to you, Dr. Forcier.
All right, let me share my screen. All right, can everyone see my screen now? Let's go here. And let's go out of there. Okay, so my name is Michelle Forcier. I use she and they pronouns, and I'm going to keep this sort of version of the slides up just so we can move through and talk a little bit about the benefits of developmental approaches when talking about and caring for transgender, gender diverse adolescents. These are my disclosures. I think the biggest ones are I'm an optimist, and as in much of pediatrics, all the medications that I might refer to are pretty much off-label. My slides are dense. They're meant to be used for resources and later use. So if folks want to look at the slides later, I'm happy to provide those for you. So, why are we talking about transgender youth, and why are we spending our time today together thinking about developmental approaches for gender identity in our young peoples and our young populations? Well, and that's because growing up is about developing our total sense of self and our total sense of identity. Growing up entails minds and bodies and hearts and lives that change and emerge as we grow. Pediatric medicine, adolescence, even young adulthood is all about these, great physical changes, mental and emotional changes in how we think and feel and process the world, as well as how we learn to socially interact and be with others. And puberty and adolescence are really, a specific time where massive gender changes and physical changes and reproductive changes happen, which gender us in terms of sort of the pink and blue world that we've grown up in of male and female identities. The wonderful thing about kids is that they are no longer just about pink and blue, and they're telling us the world is a much more colorful rainbow and much more diverse in terms of not just presentation, but how and who we are inside. So one of the things that I think is really helpful for me in providing care for gender diverse children is thinking about the reproductive justice framework, and that was created by Sister Song in the 1990s. And really, it talks about healthcare rights, and it talks about 4 core concepts of body autonomy, the right to self-determine, the right for a safe and healthy environment with the opportunity to develop your potential, and the responsibility of communities and professionals for our most marginalized. And when you think about sort of the tenets of reproductive justice, they so nicely intersect with children's healthcare rights, in particular, children and adolescents' healthcare rights when it comes to gender identity and gender autonomy. Again, people will be like, why do we talk about these things with kids and families? Well, because again, gender is a universal part of everyone's experience, and it is across the lifespan. So there are certain explicit gender cultural expectations that start very early on. Recognizing different gendered aspects of people's lives and community is an important skill and part of growing up. For professionals who work with kids, understanding gender and gender development helps us with anticipatory guidance and future planning. Understanding how gender works and understanding how gender works with children and family also helps kids and families have a language and a framework from which to understand potentially a diverse identity that they may not have had that sort of framework to understand themselves before. By talking about gender and exploring diversity in gender, we're also encouraging openness and communication with kids and parents, as well as with kids and other, child health and child wellness professionals. And we're also modeling and promoting diversity. And it's important, again, in this culture, that as healthcare professionals and as child well-being professionals, that we take this sort of modeling of acceptance, tolerance, and equity very, very seriously. So the Williams Institute, which the other slide also referenced, is really important because what we're seeing from the data, again, real data, real people, both data and people, is that gender diversity is very overrepresented in younger populations. So the percentage of young people who identify as gender diverse or transgender far exceeds the percentage that they are in the entire population. And so gender diversity and transgender health issues are actually really pertinent to today's youth and to today's healthcare and mental and medical health care for youth. So this is just really important information. Generationally, again, this is another way to look at it. This is by different segments of our population. And if we look at millennials and Gen Z, the number that identify as LGBT is huge. We know that from this Williams study that as many as 3.3% of Gen Z identify as gender diverse and exploring gender. And think about what will happen with Gen Alpha in the upcoming future. So young people are telling us that the previous models, previous conceptions of boy and girl are too limiting for the lives, both internally and externally, they're experiencing, and that we as healthcare professionals sort of need to up our game and understand that gender identity is way more complex than just pink and blue, boy and girl. All right. So this is a really nice study I like to reference. It's from Pediatrics, again, the AAP's major journal. And one of the things I like about this study is that, the big finding was at almost 10% of this urban, fairly ethnically, racially population compared to some other studies. Almost 10% of kids in this study identified as either transgender or non-binary. So that's far, far higher than, say, some of the adult studies and adult statistics that have been referenced, 1 or 2% through the years. The other piece that was really interesting about this study, again, was it captured, I think, a more representative and again, universal experience. Number one, we saw way more persons of color in this sample than we do in gender studies at gender specialty centers. Again, talking more about healthcare disparities and socioeconomic status and insurance than it does about gender. And we saw many more trans feminine persons in this population study than we did, again, in specialty clinic-based studies. So there are a host of possibly up to 10% or probably more of gender exploring youth out there, including many trans feminine persons of color. And again, these are populations that are so important and been underrepresented in the science and literature so far. So thinking about gender identity, as fraught as it seems to be in the political and social discourse, it really is just a wonderful, lovely part of growing up to be a healthy, happy human being. And this is from the Gender Book, which is publicly available. It's online, is a wonderful resource for talking about gender identity with children. And basically it talks about there's this journey of you're assigned a gender at birth, and then you go through your life and you figure out who you are. And part of figuring out who you are includes not just other aspects of gender, but your gender identity. And it's a wonderful resource in terms of thinking about and talking about gender fun, not scary, and it's educational for a lot of our families. One thing that I think is really important to think about is in medicine and healthcare, we're so used to having things be a diagnosis, have an etiology, and then we have a treatment and we fix it. And gender doesn't really fit that model. And so one of the things that I'm working on is with the AAP's clinical report, about serving LGBTQ youth. And again, if we approach both gender and sexual identity and identity formation as an expected part of human experience, then we're going to have to transform and move away from this medical pathology diagnosis-based approach to a more relevant, careful listening of who are you and how can you have a healthy development and healthy identity. So it's very, very relevant, not just to children, but it's also very, very relevant to adults and our mature persons. I've had the luxury of taking care of persons in older age groups because of the gender and sexual specialization. And gender and sexuality are components, not just for teens and young people, but for the whole population. So thinking about it in a lifespan approach, thinking about a developmental approach as we grow and mature and continue to learn about ourselves as people is so important. So a developmental paradigm implies that, again, gender and sexuality is universal. Again, raise your hand if you've experienced gender. All of us will raise our hand. We also know that in biology and in science, diversity and variance is expected. It doesn't mean it's pathology. It's a part of the biologic world. No one snowflake is the same. Why would someone's gender be exactly the same as someone else? And so that we know that then diversity is not deviance, but just something that's expected and a part of being alive. So when we're talking about care, understanding this sort of paradigm of biology and diversity and development, we know that we're really there to listen carefully, to try to help a patient meet their goals and be healthy and be happy and be a productive part of the world and do the things they want to do. We're there to provide resources and support so they can continue to grow into their healthy selves. And we're there in a larger sense and responsibility to address and reduce minority stress, which can happen in our culture when people are perceived as different. And again, on a larger, social advocacy, we are there to empower all children. So by doing gender care, I feel like I'm actually a better, in general, pediatric provider. And I'm able to model in the room for both my gender kids and families, as well as my kids and families that are there to see me for other things. I can model diversity and acceptance and tolerance and an equity based approach to healthcare in general. So gender care, when you think about it, really is primary care. It's listening to your patients and working with them to figure out what do they need to be healthy. And again, gender care is developmental, gender care is primary care, gender care is something that we all can really, I think, be involved in because gender touches so many aspects of our life. So we can start thinking about, again, developmental approaches to gender care, even with prenatal conversations. So, someone's getting their ultrasound and they say, I want to know if it has penis, if it's a boy or girl. And, the ultrasonographer or, the person doing the prenatal care can say, hey, they saw a penis or they didn't see a penis. And your baby will be assigned a male or female gender at birth based on these body parts. But who knows what their gender identity will be when they grow up? And that's so exciting. Again, when you're in the newborn nursery, you can do the same thing as you're telling your family and your parents, the baby's parts are all normal. And right now your baby's parts look normal in terms of being assigned male or female at birth. But again, over time, you'll get more of a feel for how their gender identity develops. And that would, again, add and prepare persons for the conversations that, number one, gender is a part of our growing up. And that, again, we can't assume that assigned gender equals gender identity for every single human being. And again, that's what the epidemiologic data continues to make clear. So there are lots of things to think about, lots of social theories and learning theories and all kinds of theories about gender identity. And these are wonderful and important. I'm flipping through these quickly because the slide I really want to focus on is this one, which, is related to Kohlberg's gender development theory. And really it talks about children as young as 1 year old start to really become conscious of differences between genders or the sexes. My 18-month-old child who has a gender neutral name was just in gender neutral and bi-gendered clothing. And when she was 18 months and not super verbal, but she could identify that the pajamas that she was wearing that day were boy pajamas. Again, just because she was already picking up on social cues and things in the environment that were gendered. By ages 2 to 4, kids really do know often the difference in terms of being able to label themselves boy and girl and unlabeling other folks as boys and girls. Around age 4 to 6, kids typically know that, gender is a more stable feature for people, and it will not change necessarily overnight or day to day. And then by around age 6 and really school age time, there's this constancy where people realize that gender is independent of external features, and that gender sort of, you lose your magical thinking. There's, gender will be what gender is, and it will continue to be over time. Now, this is really important because when you work with kids who are exploring gender, you'll often, or I'll often, have heard stories about a parent that said, yeah, when they were 4 or 5 years old, I went into the room around Christmas time and they were crying and they said, is Santa going to bring me my penis like my brother has this year? I've been waiting. We hear stories that youth as young as these toddler and preschool ages have an awareness that something is different and that their gender identity may not be a perfect fit for this assigned gender at birth. I've talked with persons in their 30s, 40s, 50s, 60s, 70s who have said the same thing, that they knew that either they were boy or girl, or different gender, or they knew something was different, but they didn't always have the language or the resources to bring this to their parents' attention, or if they did things that brought it to adults' attention, it created problems. So a lot of kids start to go underground. They know that things may be different. Their gender identity might be different than their assigned gender, but it's not being accepted in a welcoming and warm and safe manner. And so sometimes they hide it once they get into that school age frame. So all these theories of gender development, are helpful in terms of thinking about the science and how we can help kids. But, for parents, the biggest, I think, question, or the biggest question that parents really should think about is not why is my kid transgender? But a better question is, how can I help my kid who is transgender? What can I do as a parent, as someone who is responsible for their well-being, their happiness, and providing them with resources that will help them grow up safe and healthy and happy? How can I help them? And the how can I help my child is so much more important than the what's and why your kid is transgender. So all kids play with gender. Again, gender play is different than gender diversity. Behaviors and expression can change. They can be nonconforming. They can be diverse, but children can still very much feel that they are in the right gendered body. Gender diversity is more an issue of that sort of the standard binary of boy and girl doesn't quite fit someone. So for some, it may be a persistent, consistent, insistent presentation of, like, I was born with the wrong body parts and I really want those other body parts, and I really don't like the body parts I have, and I need a different name, and I need different clothes, and I know who I am, and I was, born a boy, and my name's Sam, but I need you to call me, Cheryl, and I need to wear dresses and have my hair long and paint my fingernails and do the things that are right for me. There's another group of kids that we identify as non-binary or gender diverse or gender fluid. And again, for these folks, it's not so much a matter of there's necessarily the wrong parts or they want to be the other gender, but gender as a binary construct doesn't completely fit them. And so they may move between genders rapidly because at different points in times, their identity and the way they feel and the way they need to express is rapidly changing. They may feel agender. Again, they have different ways to describe themselves. And so again, what's really important with gender diverse kids is to ask the youth, how do they see gender and how do they see gender fitting in with themselves in their lives? Again, why is it important to talk with kids about gender? Why can't we just wait till they're 18 years old, they're legal, they're able to make their own decisions? Well, because again, gender and gender changes in adult bodies are happening at earlier and earlier ages. So time for initiation of menarche, and that's after some of the physical changes such as breast development are happening, as early as 7 or 8 or 9 years old for breast development. Periods are occurring around 11 and 12. And again, people and kids are being gendered much earlier in lives than they ever were before. Why is this important for gender medical care specifically is because we have medications that can prevent permanent changes, permanent phenotypic changes that we cannot undo, skeletal changes, body hair changes, changes like breasts and cricoid cartilage development that might require surgery. We can put a pause on those changes occurring while kids grow up so they can figure out again, is this body that's developing the right body and the correct body and the body that matches my gender identity? Or am I developing in a body that is not right for me, in which we historically know when people develop in a body that isn't right for their gender identity, we see a lot of other mental health and other pathology that occurs because of the dissonance between who I am and the body that I'm living with. So we really want to start these conversations about gender identity even before puberty, because we want to have an opportunity to know where kids are going. We don't need to do anything about gender before puberty. We just need to listen and be open and let kids explore in safe and loving home and other environments. But there's nothing medical and there's nothing at all permanent that needs to happen in terms of gender or gender identity in this pre-pubertal age group. Now, when puberty comes along, that's so important because again, that's when those permanent changes come. Now, in the audience, I'm going to ask you all, how many of you, when you were growing up, had a provider, nurse practitioner, PA, pediatrician, family medicine doc, med peds, whoever, sit down with you between the ages of 8 and 10 and said, over the next year or two, we're going to talk about puberty because it's going to start happening. And how do you feel about it? What do you know about it? What scares you? What do you like about it? We're missing opportunities to advise all kids, not just gender diverse kids, but all kids about some of the major life changes that occur when you start and go through puberty. And so again, if we think about gender and sex and puberty in a developmental framework, then we can early on start having conversations so that talking about these things is just a part of talking about your health, of talking about your body, of going to get your medical or mental health care. So again, talking about, again, these aspects of puberty and gender and body change is so important before they actually happen. And kids do quite well with these conversations. You can make them developmentally appropriate. I'm going to talk about potentially boobies and how do you feel about boobies happening to you in a couple of years? in a different way than I'm going to talk to a 16-year-old about their breast development or their breast asymmetry or sexual function and other things. So we tailor the conversation to the developmental level of the child. So, but puberty is a crossroads. We have kids that were early affirmed and early on know that they are transgender and they should be the other gender, and they need, again, that support and those resources. And as puberty approaches, they need to know there are medications that are very, very safe that can halt the wrong puberty, and they don't have to go through the wrong puberty. So they don't have to sit there in anxiety waiting for their body to do things that to them are not right and potentially even horrible that they don't need to live through. Now, there's that silent children who know internally, again, that something's going on and something's different, or maybe they know they're transgender, and then, but they're not able to position themselves to advocate for themselves within their family or in their community to get the resources. And again, puberty is a time of great distress because they could kind of ignore it, just like the neutral children. But when puberty happens, you can't ignore gender in the same way you could when you were 6 years old. So we see puberty in gender care as a crossroads. My take-home message is not to wait for puberty to have happened, but to be preparing all youth for puberty so that those who know that they're gender diverse or want to explore gender actually have a chance to use the therapies, safe therapies and medications and care that we do have for transgender, gender diverse children. Now, this is another pediatrics article in 2021 that talks about parents and teens want to talk about these things. They want to talk about puberty. They want to talk about gender identity. They want to talk about sexual orientation. They want to talk about decision-making and STD prevention. So, you know, for us to not make the effort because we're uncomfortable talking about sex and gender really does a disservice to our patients. And I would say that, you know, in no other aspect of medicine, you know, if I'm a primary caregiver, you know, I can't say, well, I'm not going to talk to you about your blood pressure or your diabetes because I'm not comfortable with that. If I'm a primary care doctor, these are pieces of all people's health and general people's health that we need to have some level of competency in order to have those conversations. So again, our patients and our families really do want us to know more about this and to be able and willing to talk to them about this. The other piece that's really important with teens is it is not the teen's responsibility to bring up difficult topics. So it is a provider's responsibility to discuss things like confidentiality, to discuss safety, to discuss sexuality, to discuss self-harm, to discuss things and bring them up. That is not the teen's responsibility to broach tender topics. So who and when do we want to, and where do we want to screen? Well, I say we screen all children and we screen them at different developmental nodal points, like we've already been talking about. I'd say, again, screening all children for our non-gender diverse kids, again, teaches and models about diversity and helps parents understand these aspects too. I would say absolutely, when a kid gives you a clue with diverse or non-conforming gender expression, ask them what it means to them. Ask them about like their fabulous pair of awesome boots and spikes. You know, ask, be curious, be open. And then absolutely knowing the historical rates of depression, anxiety, and suicidality for the transgender population. When kids, youth, and young adults have mood, behavior, or social problems, and a change of social function or a decline in social function, talking about gender and sexual diversity is so important, again, to see if and how those could be related. So again, how do we talk about this? Well, we ask people. For younger kids, sometimes it's more a matter of asking the parents how they feel about this gender diversity and gender diverse expression. And we ask about it in the language of kids. So, you know, when you ask a 6-year-old, again, how they feel about, you know, what is it like? You are, you know, it says in your medical chart, you're a girl. How do you feel about being a girl? Do you feel like you're a girl? What's being a girl like for you? You know, asking questions, again, different than how you talk about gender identity with a 16-year-old. And again, from a parent perspective, oftentimes kids are very, very comfortable and clear about talking about their gender identity. It's the parents that might be less comfortable with, say, cross-gender or gender diverse expression. Again, gender and talking about gender doesn't have to be scary. Look at these fun and wonderful tools where kids don't even have to tell you I'm transgender. Of course, why would a 6-year-old say that to you necessarily? But they can point, where are you in terms of feeling more feminine or masculine? What parts do you have? You know, if you were to have a crush on somebody at school, you know, who would that crush be on? And is it a boy, girl, or neither or both? So there's a language that's non-gendered, and there's a language that's safe for kids to describe their gender experience. Again, back to the Gender World Book, this wonderful resource about looking at the variety of ways to consider and be gendered. I might be born in Ladylandia. I might move to Manlandia. I might live in the agender satellite and not feel that any gender really represents me. I might live in the gender fluid cruise ship and move between many islands and many different aspects of gender. So we can talk about gender in so many different ways. And again, the key is talk about it in a way that makes the child feel safe and comfortable. As we talked about already, a developmental framework allows us to offer these discussions throughout the course of a child's life and healthcare, and increase the sophistication as we get to adolescence, where we do want to be explicit about privacy and confidentiality and the legal and institutional sort of constructs of how medical and mental health places protect privacy and confidentiality. We want to share with parents that we understand that healthcare professional capacity to have this privacy and confidentiality. We will be offering your child best evidence-based, safe, healthy, positive recommendations, and that this alone time with youth is not about keeping secrets. It's about letting each and every child have a safe space to speak with a professional about stuff that may be hard for them to talk about with their parents. And again, talking with kids in the language that makes sense for them. So let's talk a little bit about gender affirmation, because that's one of the sort of hot topics out there. And gender affirmation, again, is important because such a large proportion of our children and our youth are identifying as gender diverse. And we know that not affirming gender identity and demonizing, pathologizing and victimizing diverse gender identity is actually very, very harmful. So what is gender affirmation? Well, there's the policy statement from 2018. It was renewed in 2023. And basically, what gender affirmation is primary care. It's you have a patient in front of you and you take a history. And you take a really thorough, extended history about their gender identity. You talk about their home and their school. You talk about their mental health. You talk about their physical health. You're talking about them as a whole person. And you take this sort of, in-depth history to get to know this kid. And as they start telling you about their gender experience in this open and accepting space where you're listening carefully, you are, again, gathering facts, gathering information so that you can, with their parents, make some recommendations about how they can continue to grow and be healthy, whatever their gender identity is. Gender affirmation process isn't throwing hormones at people. It's not sex change surgeries and pediatric clinics. It's about getting to know a child and a family and having them able to articulate what is their gender identity and what are the resources that they need to have a gender identity in their brain and their heart, be congruent with their body, and be accepted and loved as authentic selves in home, which is in study after study after study been linked to much, much healthier outcomes. So again, when we look at what gender affirmation is, it's actually good healthcare 101. Start by listening to your patient. Start by taking your patient seriously, respectfully, and at their word, and with them explore what is going on. Now, again, there's a whole world out there that would like us to think this is radical, this is frightening, this is experimental. Guess what? gender affirming care has been around for about 50 years now. And we have some science and we have some data. And like every other aspect, we're never going to stop looking at research for heart disease and cancer. And we shouldn't ever stop about looking about science and research for supporting gender diverse children either. But it doesn't mean the recommendations are experimental or socially, some sort of social fad. So again, we're looking at a time in our lives where a significant number of states make not only getting transgender healthcare hard, but they really are explicitly messaging that being transgender is not safe. And what a horrible, horrible message for adults to be sending to children. That you are not safe, you are not cared for, and you are demonized for who you are in different parts of the country. It makes me very sad, and it makes a lot of kids and families very fearful and very, very stressed. There is a whole, this is a great article, by the way, where they really tease out some of the backgrounds and some of the stories behind these experts who don't care for transgender children, who are testifying in multiple political settings or legislative settings about, again, the dangers and the harms of transgender care. You can take any scientific study and turn things around. And again, that's what they're currently doing. And again, we do have science, we do have research that suggests, again, there is a greater harm in not accepting our children and not listening to our children than there is in helping them explore gender in a safe and supported and loving environment. So, just remember that the internet, has been used and the media has been used to disseminate certain information. I think it's a hot topic because it's interesting. They can create lots of conversation and political and social dissension. And there are people who have personal and religious philosophies. But if we go to the science says that affirmation is the way to go. And we'll talk more about how to talk with other people about that science. Early identification, support, and access to care and benefits really, again, study after study after study over years continues to demonstrate that benefits outweigh risks. Good studies that I like to cite for parents of children or other folks are the Russell 2018 study. When a parent just uses the asserted name and pronoun, they decrease future suicidality. So just by being flexible and saying, yeah, I know I named you Bob and I love the name Bob, but you're telling me it's really important to call you Samantha. So I'm going to call you Samantha. And I know by calling you Samantha, I'm actually, as a parent, protecting you from being suicidal and the risks that come with being suicidal as a young trans person. That's huge. That is an intervention we cannot ignore. Turban, same thing. Kids that knew about blockers, kids that knew that there was access to blockers, even if they didn't use blockers themselves, they had a long-term reduction into their adult years of suicidality. Again, people didn't even have to use the medicine, but understanding that there were options for care, that there were ways that they could help themselves reduce these huge minority stressors and other traumas that our trans persons undergo. And then in Chen 2023, again, kids that got gender affirming hormones, estrogen and testosterone, they were healthier. Big shocker. If I get to be myself, if I get to live safely, if my family loves me, I'm going to be a healthier individual. Duh. That's where science, again, backs up some of these things that seem intuitive and gives us confidence that, again, listening carefully to kids and helping them create a safe gender path is the way to go. Again, Ryan and Olson studies confirm time and time again the importance of family acceptance. And again, if home is safe and loving and accepts you for who you are as your authentic self, you'll be a healthier kid. Again, there are studies. This is a science, there is research. Again, 425 results just for 2003 under transgender youth. So, when people say there's no science and it's experimental, untrue. The Family Acceptance Project, again, in terms of parent support, protecting against suicidality and a whole host of negative health outcomes, so important in terms of, again, literature and why families really need to not necessarily understand, not necessarily like that their kid is gay or trans, but to accept it and let their kid know that they're loved regardless of their gender or sexual orientation. Same thing with Trans Youth Project. Kids that grew up early in environments that were affirming, they look like their siblings or their or cisgender peers in terms of depression and anxiety, which is so much lower than the rates of depression and suicidality in adult populations historically. Again, another study talking about family connectedness, safe spaces with school and teachers, feeling safe in the community. Study after study continues to support that, again, getting care for gender diversity or transgender or gender dysphoria is a positive experience for youth. Again, this is a really nice reference in the sense that when someone says there are no randomized clinical trials that tell us that this is the right thing to do, well, there never will be one, because we have so much data to date that already says that transgender affirmative care by far has been demonstrated to be the way to go. We know, in fact, that reparative therapy is harmful and even unethical in certain parts of our country, that there will not be a randomized clinical trial where we withhold medications from some patients and we give medications to others. So again, when people say there's no good science, no, there's a good 50 years of science. It's growing. There will be no studies because it is not ethical to have that sort of randomized clinical controlled trial. And there are zero studies that say making fun of kids, victimizing kids, shaming kids about their gender or sexual identities has any beneficial health outcome. There's just no study that shows that. And so that's the counter to some of the claims in the political and politicized gender world of why gender care and the affirmative model is so powerful. It's a thoughtful, careful model where people continue to look at it, continue to think about it, continue to want to improve it. But we have a fair amount of research that says it is a correct and safe and healthy direction for our children and for our young adults and for our older adults to go. So in a gender framework, we want to start looking at gender across time, prenatally, differentiating between the gender you're assigned at birth. We want little children to explore, how can gender be different? Why do we have to have this is a boy toy, this is a girl toy? I had one kid that told one of the pediatric residents when he said, do you like to play with boy toys or girl toys? And this kid said, there are no boy toys or girl toys. There's just toys, duh. And it was a brilliant moment, again, where we're people. And there's a wide range of gender diversity and gender expression and gender identities among people. Again, the affirmation process lets us look at all the different ways. Some might be just social, some might require medication, some might require surgery, but it lets us look at it as a large network of ways to support people who say, my gender identities doesn't exactly fit what I was assigned at birth. How can you as a medical or mental health care professional help me achieve those gender goals, which is what we do in healthcare and mental health. So again, is transgender healthcare safe? Well, obviously discrimination and hate are not safe, and they lead to minority stress. And we have a fair amount of data about gender affirmation. Minority stress theory really is a nice way to think about points of intervention where we can decrease minority stress and lead to potentially healthier, better resources and healthier outcomes. So again, there are ways that we can improve the lives, not just of our transgender children and adolescents and young adults, but all transgender lives and persons. And today is a day of remembrance for those persons whose minority status has put them at risk for victimization, assault, and murder. And to be murdered because you're a trans individual just breaks my heart. And it breaks my heart that parents and kids have to worry about that. And they do. And it's real. And we can do more to talk with them and help them, again, not just have a safe personal journey in their gender identity, but have a safe community in which to live and be their fullest authentic self. So let me get to the conclusions. Again, to affirm or not affirm, there is no question. Again, the studies weigh so incredibly heavily over listening to your patient, respecting their experience and perspective, and being there with them. We want to provide kids, like with any issue, with resources so they can feel better, they can have the support they need. We want to, hi there, can you, I'm doing a talk, can you hold on for a minute? Hi, I'm doing a talk, can you come back in about 10 minutes? Okay, all right, no worries. Okay, so we can and will do better. And we want to be curious. We want to communicate again during regular primary care. We want to communicate and do better. Again, as a community and culture, about diversity is accepted, diversity is valued. Again, diversity is part of being human. So those are my conclusions. And again, for providers and professionals, some dense slides about things that you can do in terms of your practice and your care. Again, repeating what we had pretty much talked about all day, but again, giving you some synopsis and some options. This is my contact. Oh, it doesn't have my contact information on there anymore, but I am happy to answer any questions, happy to talk about anything people want to talk about. And the floor is open in terms of having a conversation about gender.
Thank you so much, Dr. Forcier.
Sorry about the interruption. I'm moving my parents out to assisted living this week, and so we have lots going on.
My goodness. Thank you so much for being with us, even though you have so much going on. We have a bunch of questions. Thank you folks so much for submitting them. So I'm just going to jump right in. What recommendations do you have for healthcare leadership members who are hesitant to provide gender affirming medical care for youth because of liability fears and not wanting to, quote, open that can of worms?
Gosh, I guess I would say if you're healthcare sort of leadership administration, give me 1 second. I'm going to ask them to be a little bit more quiet. Thank you. See, medical care, healthcare is all messy and all a part of being real. So if your kid was transgender or your grandkid was transgender, would that be an acceptable answer to you, looking at an institution and looking at leadership? For me, the answer would be no. And for me, the answer, even now in the political environment and the repercussions that I have personally as a gender provider, is number one, it is unacceptable for adults to bully children. And as an adult and as a professional, it's not acceptable for them to bully me either. And I'm going to stand firm in doing what's right for children. Child equity is hard in our culture. Advocating for child safety, child, equity in education, in healthcare resources. Those are hard things, but it doesn't mean they're not worth doing. In fact, they're that much more worth doing because those kids aren't representing themselves. And so we as healthcare leadership really need to be present and helping them along the way, especially knowing how important social support and adult safe, acceptance is so critical to them growing up healthy. So we're investing not even just in their, say, gender diverse childhood, we're investing in a whole future of gender diverse folks who are going to be socially, psychiatrically, and physically so much healthier. And for me, that is an investment that is worth committing to.
Thank you. So, my goodness, so many questions.
I always need to come back if this is a topic that people are like, we didn't get time to get everything taken care of.
Thank you. At what age do you recommend providers begin to ask children directly about their gender identity rather than using parents' response? At what age do you recommend asking children about sexual and romantic orientations?
I talk about gender identity, again, early on, if you've got a school age visit, I might talk with a family about, your 6-year-old starting first grade, like, what's the setup for bathrooms? Do they have do they have individual bathrooms? Do they have, female, male bathrooms? Like, which bathroom do you want to use? How are you feeling about, like, the way do they break your gym class up into boys and girls? Who are you? How does your gender identity being a girl factor into all these other social things that are going on for you? For sexuality, I might ask, my daughter had, like, not a boyfriend, but in preschool there was a special person in her life that she was close to, that she had a crush on. Like, these things happen, and so we talk about it in the right way, like, oh, who might you crush on? Who would you be, interested, or who are you romantically interested in? 7-year-olds know about all this stuff. They're part of the world, listening to the media, watching TV. Again, it's about asking them, like, who would you want to hold hands with? Who would you want to, talk with at school? Who are you interested in? Who are you crushing on? Things like that. And then again, as you get older, you talk about, more specific things like behaviors. What behaviors are you engaged in? But you don't need to talk necessarily about some of those behaviors with younger kids. And talking about gender and sexuality with younger kids also, you can model and promote safe touch. You can model and promote consent. Your body is your own body. No one can touch it without your consent. No one should be talking about your body. They don't need to. And so by talking about gender and sexuality in a very normative framework, we can give kids tools just to navigate growing up in their bodies, which is primary care and just healthy kids.
Yeah, we could have all probably used, or most of us could have used more of that. Can you discuss your opinion on whether trans medical care is better delivered in contained programs specifically for trans folks, or better delivered within primary care as a basic function of excellent primary care, and why?
Again, I think, if I were to ask everybody in the audience, raise your hand if you have gender, everybody's going to raise their hand. And if I were to say for our older members of the audience, how many of us have gone, say, for reproductive health services or sexual health services or even menopause services, and have someone in primary care say, well, I don't really know how to do that, or I'm not comfortable doing that. Again, we're all going to go through sexuality. We're all going to go through puberty. We're going to all go through menopause. It seems like there is so much room for primary care to really gain some opportunities to train, to educate, to learn, and then provide that to their patients. Think about the role of primary care. We want the primary care provider to be close and engaged with their patient, right? Close and engaged with the family. Gender care is all about being close and engaged with a family. Now, if you have a primary care person who can't do that, then a specialty gender center, or for kids who have maybe more complex situations, then yeah, those are great too. I don't think it's either or, but I don't think that everybody has access to the super specialized gender center. And they have a little bit better access to primary care. So primary care, I think, is part of the solution regardless. And I don't think you have to make it like throw out specialized gender care. There's use for people who have a higher level of expertise there too. Again, that's the beautiful thing about, I think, gender care, is it tells you that there's no yes or no either or. It's how can I get that kid the services they need, period. And that's not a yes or no question, which is really, for me, makes gender care really cool to deliver, because you really have to think and you really have to listen and know what your patient is asking for.
Oh, and could you stop the screen sharing just so we can change screen? Thank you. Then let's see, we've got, how do you move the needle of affirmation with parents in the setting of an appointment?
We've moved the needle from affirmation from like, there is no way my kid is going to get gender care to, people crying and hugging and everybody, having a love fest at the end of the visit, and we're starting tea today. For my part, what I tell parents is this: we both have the same goals. Even though, you may be really hesitant or wanting me to tell you today, this is just a phase. Don't worry about it. Go home. Don't think about it. But we have to recognize we have the same goals. I want your kid to be healthy. I want your kid to be safe. I want them to be happy. I want them to have a really good life. So do you. I'm going to tell you from my medical experience in 25 years of taking care of kids and teens and people of all ages with gender and sex. I can tell you that if you help your child figure out who they are, what their gender identity best represents them, your kid will be safer. Your kid will have less risk of suicide. Your kid will have less risk of depression, anxiety, less risk of HIV, a whole lot of less risk. So you may not feel super comfortable because you weren't expecting a kid that was trans. You were loath to give up that beautiful name that you gave them at birth that is so special to you. But I would ask you to think about having your kid be healthy, safe, and happy. What is that worth to you? And I think it's worth a discussion about some things that are actually very safe, not even permanent, that you can do and offer your kid so that they have a really good present life and also long-term future existence. And I think, again, I'm not saying you have to believe me, but I am saying I have no vested interest in anybody being trans. I have a responsibility, though, as a pediatrician. I am here to represent your child's best interest. And, if you are saying like, well, I want them to wait till they're 18, and there's situations where that's not in your child's best interest, I'm going to say that's not medically indicated. That's offering harm. You saying, I'm not going to allow treatment is actually a decision. It's not a no decision. It's a decision. And in some cases, those decisions do offer harm. And so let's talk about a way that we can get to a place where you feel more comfortable understanding more about your child and their gender identity so that your child can, again, be happy and healthy. And again, so you can understand gender is messy and complex, but the most important thing I can do is look at my kid and say, I love you and I'm listening. And no matter what, we will figure this out together and you will get what you need. It might take me a little while as your parent because I don't quite understand it, but the more we communicate, the more I learn, the more you can share with me about how important this is. As a family, we can make decisions that are healthful for you. And again, that's why they hire then the healthcare professionals to again say, well, these are your options and this is good, or this is less good, or this is, this is really, 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 really safe. And there is zero, worry about this therapy. That's why we're having a conversation. And maybe you're ready to make decisions at the end of today. Maybe you're not. That's okay. Come back next week. We are here. Mm-hmm. And if a kid has a family that says, we're never coming back, I say, we're going to be here when you're 18, and you make that appointment for day 18 and 0. And again, we are here. We are here for you, and we're listening carefully. And we really want you and your family to have everything that in our power that we can provide for you to be safe, healthy, happy, and have a good life.
Well, that seems like a great note to end on. We had a number of questions for folks asking for resources, so I'm assuming we could direct folks to the American Academy of Pediatrics.
American Academy of Pediatrics, the University of California, San Francisco Center of Excellence has all kinds of great medical resources. Fenway has wonderful resources for medical providers with gender and sexual diverse patients. And those are ones that people access all the time. Mm-hmm. Listen and Trans Youth Equality Foundation are good, some online resources for parents, and PFLAG for parents and kids, and PFLAG is helpful sometimes for families and parents who are trying to figure things out and get support just for their own perspective.
Mhm. Awesome. Well, thank you so much, Dr. Forcier. I wish we had another hour with you because people have so many questions, but thanks to everyone who signed up for today's webinar. Thank you for sharing your expertise and time with us. And yeah, thanks everyone, and have a great rest of your day.
Thank you. It was a privilege to be here today. Thank you for your time.
Thank you.